Good morning, everyone, and thank you for joining us today. My name is Noraida Negron. I'm the Public Information Manager for the City of Laredo, and I have the honor of serving as your MC for this important event as we come together to recognize Mental Health Awareness Month. Today's proclamation is a reminder that mental health is an essential part of the overall wellness, just as important as physical health. We're here to not only raise awareness for the month of May, but also to continue the conversation and the advocacy for mental health all year round. Before we begin with our speakers, I'd like to take a moment and recognize our distinguished guests that are joining us today. First and foremost, our Mayor of the City of Laredo, the Honorable Dr. Victor Treviño, and his wife, Ms. Rosa Marquez de Treviño. Representing the Laredo Fire Department, Chief Guillermo Hurd. Our Laredo Health Department Director, Dr. Richard Chamberlain. We also want to thank Ms. Julie Basan, the Executive Director of Area Health Education Center. Thank you all for being with us today. I am proud now to introduce our lineup of speakers who continue to lead the charge in promoting public health and well-being in our city. First, please help me welcome Mayor Dr. Treviño, an advocate for health in our community.
Thank you and good morning. Dr. Victor Treviño, Mayor for the City of Laredo. We're here to bring awareness to Mental Health Awareness Month. Despite the progress in mental health and the initiatives, more than 30 million people in the U.S. still have lack of access to comprehensive, high-quality care. And these statistics highlight the ongoing need for mental health awareness and Awareness Month and the importance to bring attention to this disparity. 1 in 5 U.S. adults experience mental illness each year. 1 in 20 adults experience serious mental illness each year. 1 in 6 youths have a mental health condition, but only half receive treatment. Your Mental Health Awareness Month, an annual observance founded by the Mental Health America in 1949, we highlight the importance of mental well-being, educate the public, reduce stigma, promote support for those affected by mental health conditions. Mental health awareness in Laredo plays a key part in reducing stigma, encouraging early intervention, and fostering empathy and understanding. By normalizing conversations around mental health, it nurtures a more compassionate society where individuals feel empowered to seek help to improve mental conditions. And as mayor, we do also our part to normalize these conversations so we can eventually make sure that mental health becomes our everyday lifestyle and we can build a better and healthy Laredo for everyone. Thank you very much. We'll stand by for the proclamation.
Thank you, Mayor. Next, we'll hear from Dr. Richard Chamberlain, Director of the Laredo Public Health Department, whose leadership has also been instrumental in expanding all the services and mental health outreach across our city.
Good morning, everyone. Thank you so much for being here with us today. I'm going to take the words that the mayor just mentioned right now about lifestyle. That's something that we definitely champion here at Laredo Public Health. So I want to take this moment to underscore something that impacts every one of us, which is mental health. It is not a luxury, it is a foundation. Mental health influences how we think, feel, connect, and function at home, at work, and in our communities. Yet, too often, mental health is sidelined. Stigma, silence, and systemic barriers keep people from getting the care they need. But there's hope, and it's rooted not only in therapy and medication, but also in the evidence-based principles of lifestyle medicine. As a certified lifestyle medicine professional, I'm reminding you, it isn't just about living longer, it's about living better. It focuses on 6 scientific grounded pillars that improve mental health and emotional resilience, beginning with nutrition. What we eat profoundly affects how we feel. A whole food, plant-based, predominant diet rich in fiber, healthy fats, and micronutrients doesn't just nourish our bodies, It feeds our gut microbiome. And we know that our gut and our brain are in constant communication through what is called the gut-brain axis. Our gut microbes produce neurotransmitters like serotonin and GABA, chemicals that regulate mood, stress, and anxiety. A diverse, fiber-rich diet helps cultivate a healthy microbiome, which in turn supports emotional balance, cognitive clarity, and mental resilience. We follow this with physical activity. Movement is medicine. Regular exercise releases endorphins and reduces inflammation, making it effective as antidepressants for mild to moderate depression. It also enhances neuroplasticity and helps protect against cognitive decline. We follow this up with restorative sleep. Sleep is not just a passive activity. It is an active process of healing and memory consolidation. Without adequate sleep, emotional regulation and mental clarity suffer. Prioritizing sleep is a cornerstone of mental wellness. Next up is stress management. Chronic stress alters brain structure and function. Practices like mindfulness, deep breathing, and meditation reduce cortisol levels, which is what causes inflammation, and helps us respond rather than react to life's challenges. This comes by, followed up by avoidance of risky substances. Substances like alcohol, nicotine, and other drugs may provide temporary relief, but exacerbating anxiety and depression in long term. Lifestyle medicine emphasizes sustainability and healthy coping mechanisms, avoiding all risky substances. Positive social connections, which is what we are doing here. Human connection is not optional, it is biological. Isolation increases the risk of depression, anxiety, and even premature death. Investing in supportive relationships, healthy relationships, builds resilience and provides emotional grounding. These pillars are not quick fixes. They are protective factors, sustainable daily choices that empower us to support our mental health proactively. Thank you for your time.
Thank you, Dr. Chamberlain. Joining us also is Dr. Julie Basan, Executive Director of Area Health Education Center. She's a key partner in health education, awareness, and training for future health professionals in our region. Please welcome.
Good morning, everyone. Thank you so much for the invitation to come and stand here with you all as we create awareness about mental health. Thank you, Dr. Chamberlain, for your leadership. Thank you, Mr. Hurd. Thank you for everything you and your fire department team do for our community as first responders. Mayor Trevino, thank you for everything, all the initiatives under your leadership. Ms. Trevino, thank you for always being part of this amazing group as a cheerleader, #1 cheerleader in the community. Thank you. And thank you, Councilwoman Cigarroa. Thank you. The entire team at the City Public Health is amazing because they understand the importance of mental health, the importance of the initiatives that are led by this team. And this is one of the reasons why it's important for us to come together, to continue to collaborate and learn from one another. We learned from the mayor some of the statistics that are horrific. We learned from Dr. Chamberlain how to deal with mental health, from spiritual to physical activity to nutrition, and he shared some wonderful research-based information. So thank you for that, Dr. Chamberlain. What I want to tell you is very simple. Mental health issues impact all of us, and it's nothing to be ashamed of. It's nothing to be embarrassed about, because it is okay to not be okay, as many of us like to say. There is always someone around you that will listen to you, that will understand you, and if not, if you feel you do not have that someone, you can call and reach out for help. We have numerous services in our community available, but sometimes we say, well, if I go there, they're going to see me walking in, they're going to know that I have problems. Then call 988. It's the national free resource available 24/7 in English and Spanish. Do not be ashamed, do not be embarrassed. On the contrary, reaching out for help means that you are brave, you want to continue to be well for you and your family. One of the simplest things that we can do as members of this community is stop doing negative self-talk. If we stop talking negative to ourselves, that's already a plus. I mean, raise your hand if you've never done negative self-talk. You see? Why can't we stop? Let's turn that into positive talk. Whatever negative remarks you're telling yourself, make it positive. And if you do that, I guarantee you that you will boost your self-confidence, you will boost your mental health, you will boost everything that is around you, your environment, the people, what you have scheduled for that day. Yes, it'll probably be a stressful day, but you're already on the right mindset. So that little minor step that you can take in the morning, instead of saying, oh my God, fill in the blank, whatever you tell yourself, turn it around and say, wow, I'm awake, I'm alive, I'm gonna do this, I am beautiful, because you are. Each of us are beautiful. We just don't see it. How come we can go and tell our friends, our colleagues, I love the way your hair looks. Oh, you look beautiful. You're so handsome. I love that outfit on. Why can't we do it to ourselves? Be your best friend and make your mental health better today. Thank you, everybody.
Thank you, Dr. Basan, for those amazing words and reminders, because we all definitely need them. Finally, we're going to hear from Ms. Erica Lopez, Assistant Outpatient Treatment Program Manager with the Laredo Public Health Department.
Hello, good morning. It's truly touching to see so many people here today because it's a true indication that we are here together to reduce the stigma around mental health. Being a part of the Laredo Public Health Department, we work together to acknowledge that mental health is a public health concern. With programs such as Juntos for Better Health, the LETS program, and the Assisted Outpatient Treatment Program, we do work together daily to reduce all those barriers that prohibit some individuals from obtaining the help that they truly need. In retrospect, we usually see that individuals in mental health are categorized as a statistic. But I'm here to remind you that it's not just a statistic, it's not just a number, but it's individuals such as our local law enforcement officials, it is our teachers, it is our medical staff, it is all those around us, because mental health does not discriminate, and neither should the services that we have available for our staff. So thank you, everyone. Thank you to Laredo Public Health for providing these services not only to the community, but to our staff as well. And thank you, everyone, for being here daily, advocating and reducing that stigma for mental health. Thank you.
Thank you to all of our speakers, and at this time, I would ask our Mayor, Health, Dr. Basan, our council members, everyone to come up here to do the official reading of the proclamation.
Can y'all please come and get in the photo? You're not alone
Yes,
at the end.
Right.
together.
Thank you, ladies. One on each end, please.
Usted también,
Gee.
que no le dé pena.
We're gonna do the Friday crowd.
All right. Office of the Mayor, City of Laredo, Texas, proclamation. Whereas mental health is essential to everyone's overall health, well-being, and addressing the mental health needs in Laredo of children, youth, adults, seniors, and families is fundamental to having a healthy community. Whereas all people experience times of difficulty and stress in their lives, and with the prevalence of mental health conditions in our nation, it is important for all members of the community to know that specific tools exist which can be used to better handle challenges and protect one's health and well-being. And whereas prevention is an effective way to reduce the burden of mental health conditions, and with early effective treatment, individuals with mental health conditions can recover and lead full, productive lives. Whereas it is appropriate to recognize the importance of improving mental health in all of our residents, and Laredo is committed to raising awareness about mental illness, promoting effective community partnerships and collaborations to serve the mental health needs of our community, and increasing access to culturally appropriate mental health services. Now, therefore, I, Dr. Victor D. Trevino, by the virtue of the authority vested in me as Mayor of the City of Laredo, County of Webb, State of Texas, do hereby proclaim the month of May 2025 in Laredo as Texas Mental Health Awareness Month, and encourage all citizens, businesses, organizations, and agencies to work collaboratively to reduce the stigma of mental illness and to increase the mental health in our community. Thank you. All right. Get a picture.